Welcome to another Empowerment Tuesday on the Field Podcast. It's not a one-on-one, it's a two-person show today. My friend Erin Copelan is here with me. Follow Erin right here on Substack. She's got a ton to share. You're going to hear from her today, and then you're going to have a chance to go follow her on Substack so you can learn even more from her. If you follow us here, for any amount of time at the Embracing Layers Network or listen to the Feel podcast or Together We Feel panel shows that I do, you've met Erin multiple times. She's a friend. We met through doing this work together. Initially, she was a podcast guest. She's been doing these with me for years now because she brings so much to the table. She works specifically with caregivers and making sure they're taking care of themselves well as they're taking care of their sick loved one, friend, neighbor, whoever it is, child, whoever it is they're caring for. Through this process, she's learned a lot about our topic today of communicating effectively with our medical care practitioners. She's got a truckload of experience in this area, as do I. And go to erincopelan.com, Copelan, no D at the end, just all one, to learn more about her story with her husband. This is continued with her parents and grandparents through the years of advocating and asking the right questions. She has a whole list of resources to support you. For me, if you follow me at all, you'll know my story of how I wanted to start this whole conversation 5 years ago about taking care of ourselves and allowing ourselves to thrive and heal and feel because of my own experiences with my own health. Also my children grew up, and I had one that had some very unique medical situations going on that we didn't get a diagnosis for till she was 19 years old. So we spent 19 years advocating for her. So this is an area we're well versed in, but I was having a conversation with our friend Kim Mosman. She couldn't join us last week, and she and I were talking about what we were dealing with currently in our own lives, our spouses' lives, our parents' lives, medically. Questions we were, roadblocks we were running into to get the care we needed. And how it was just absolutely exhausting because the insurance companies hope to wear you out, that you'll just quit asking the questions and try to get the coverage. Erin knows that very well. I've experienced that. I've gone through it. I haven't slept well in 4 years. I've been working. I've had multiple sleep tests. I've tried to work with multiple practitioners. I've been told no by the insurance multiple times. I finally got a yes. And then when they were working on a device to help me, the insurance said no again. I wasn't serious enough. They basically needed me to fall asleep at the wheel and run over somebody before then it would be serious enough. I mean, it was just, I'm kind of exaggerating, but kind of not. There was an angel in that office. Shout out to the angel at Fresno TMJ and Sleep Health Clinic here who went to bat for me. She stepped in when her billing people were getting a no. She stepped in. She superseded. She said, no, this woman hasn't slept in 4 years. She's been told no by the insurance multiple times. They wouldn't let her go see the specialist at Stanford. She's had a surgery. She's had all these things. I am getting her help. And she just went in hard and got me the simple coverage to simply be able to go get my checkup done, to get measured for this device that we're hoping will help me. So there are those angels out there. There's other angels that help me find these people out there that I want to shout out. Ayana, if you're listening, I'm shouting you out today. Woman, you helped me tremendously even get to this point. And so there are angels. There are also people, sometimes you have to walk away from doctors because they just aren't listening to you. If you're being gaslit, if you're being minimized. We had one experience with our daughter when she was young. I thought my husband was going to punch this neurologist in the nose. Like, my husband's not a physical altercation guy. He's a big, imposing guy, but he's not a physical, but he's very curious. He asks a lot of questions. And when he shuts down and just gets this look on his face like this, I'm like, oh my God, he's going to jump up and punch this guy, because we were just getting gaslit. Our child was getting gaslit. So there's also those experiences out there. There's the full gamut. So it is important, regardless of what your situation is, going into your practitioner's office, whether you love them, whether you're not sure about them, whether they're new to you, to go in ready, go in prepared, and expect to advocate for yourself. So Erin, thanks so much for joining me. You have so much to say about that. Do you have anything you want to add to that before I go into? We're going to answer some key points today as we walk through this.
No, I mean, you covered so much in that. Like, I've had all of those experiences and then some, and there is an art to communicating, and that's just kind of a rule in life. And I think sometimes we do forget that our medical professionals are human, and so we have to bring a special set of communication skills to the table, because they are not psychic, they cannot read our minds, they have to filter what we are saying, what we have forgotten, what we are not saying, there's a lot that is happening. And so really sharpening communication skills is so important.
Yeah, absolutely. So let's get right into it. I'm going to go through some key questions here, and Erin and I are each going to give our take on it. So we've kind of already answered it, but this first one is why self-advocacy, can I say the word, is essential in today's healthcare system. I'll let you go first.
I think that's a good rule for life.
Oh,
God
yeah.
helps those who help themselves. If you just go and surrender your care and you do not have any accountability or autonomy, it's not really acceptable. I'm just going to say it. Like, we have to take ownership of ourselves. And there is a learning curve, and we don't know what we don't know, but we also have to take some responsibility for that. So to just walk into a room to a total stranger and be like, just fix this, without doing the back and forth and talking to different people and doing the research, it's exhausting and it's terrifying. So I'm not diminishing any of those feelings, because it is straight up an entire other job, especially when you have something serious going on or something chronic and you're not getting the answers that you need. It's so incredibly frustrating, but we have to take responsibility for our own health.
Yeah, we do. Absolutely. And we'll get into this later. And we'll talk about it down the road here in a few minutes about, we know our bodies better than anyone else. And so trusting that. And so, but for me, the self-advocacy became important because our doctors and our practitioners see many, many people throughout the day. The more prepared we come into the conversation, the clearer and more concise it's going to be. We lessen the opportunity of having to come back again and re-explain or not get what we need and go home and realize, oh my gosh, I didn't ask this and this and this. I need another appointment. And it just prolongs what we can either get from them or who, excuse me, love it when we go live. I have a little coffee episode and you got to hear it. So I had learned, and this really, like I said, became clear with one of our kiddos growing up, and even in my own, as I went into perimenopause in my mid 40s, things were starting to happen in my body that were being treated as all these separate one-offs. I'm like, hold the fort here. All this stuff started at this particular age. I think maybe it's all connected. And so can we have that conversation? And so it drove me to look for a different kind of care and a more holistic approach where they're piecing all the pieces together. But that came from me, because initially I hadn't had many issues in life. I had a doctor, she knew me well, and I lived in a place for 9 years. She knew me well, and she would let's try this, let's try that. She was a Western approach med, but she was also curious, and she was not afraid to say when she didn't know. And she was not afraid to refer us out to someone else, and her curiosity. And so I kind of I don't know if I took that for granted or what, but when I went, we moved from there and I tried these other different spaces, it was just I don't feel like they're listening to me, or they would gaslight. I've got in a actual fight with a doctor that we had in the Chicago area about the immunization she was insisting we have and don't have. And I'm like, well, what about this or what about this? My daughter has this, so do we need to consider that? And is that one maybe a better option? And she just wouldn't listen to anything. Her attitude was, I'm the doctor, I'm the expert, you need to shut up and listen to me. And to get that from another woman was really, really disheartening. And I also know she meant well, but she didn't know the history of one of my kiddos. And so I was trying to explain to her, she needs to be approached with a different lens. She doesn't fall under this prototype. So I have some concerns about some of these approaches, and I want to make sure we're taking the measures that are actually healthiest in this situation. So can we just talk about this? And she just wasn't interested. This is what you do. I'm the expert. Shut up and leave. And so at that time, I'm like, okay, we're done with her. We're not doing that anymore. I will not engage with someone. So yeah. So, but I think it's knowing your body, trusting your instincts. If you're your parent, knowing your child's, if you're advocating for a partner, being well-versed and also being willing to walk away. But that self and remembering what Erin said earlier, they're human. And if it's not working between the two of you, you're not going to get the care you need.
Yeah.
Yeah. Okay. How to communicate symptoms clearly to your doctor, Erin.
So before I wrote my book.
Yes. Hold up your book. Show everybody the book. Go to erincopelan.com. She's in the process of reinvigorating the book.
Actually, I'm not.
Perfect.
This is the baby. This is it. And you can get her on Amazon, and she's in paperback. It's a real book, not a pamphlet. Paperback.
Yeah.
Audio, and I did the audiobook too, and Kindle. So
yeah.
But before this came, my initial dream was to help patients and caregivers communicate with medical professionals. That was the original dream. And I created the patient handbook, which was a series of pages to go into write down all of your questions. It has a body, and that's in the process of being reworked, so it's more digital and downloadable, because it used to be a binder system. But it had, which is on my website, the body scan checklist is on the website, and it has a human silhouette and different symptoms. So you can either just take it yourself, or take it, if you're a caregiver with your patient, be like, okay, let's start at the top. And here's something like, how's your head feeling? How are you feeling? To mark all the things. If you do it in the car ride on the way there, if you do it while you're sitting in the waiting room, it works too. And then a place to write down your questions, because I would get white coat syndrome, and the doctor would come in, and it was like taking the car to the mechanic, and I would feel fine. Be like, well, I thought my shoulder hurt, but it doesn't right now, because adrenaline and like all of the things that mask our signs and symptoms. My brain couldn't remember anything. And then you're like, I don't know why I'm here. It's good. I'll see you next year. Like, I blew my own appointments. And then with Jerry in the transplant, with my grandparents and my mom, just helping other people communicate who aren't necessarily in a position to communicate for themselves is a really big deal. So having those conversations in a time of calm before there's the rush, because I also get very anxious. You know that feeling when you're at like girls' brunch or happy hour, and you feel like maybe you've been there a little bit too long, because the server keeps walking by and is like, do you need anything else? And you're like, oh, we should probably go. Like, we've been here too long. I get that anxious feeling at the doctor's office. Like, I got 10 minutes. I got to shove it all in there. Have I ever said to the doctor, I'm feeling crunched for time, but I have more things. Like, are we okay? I've never actually asked anybody that. I try to read their body language. I try to guess. And so what do we ask that? I mean,
I know.
I'm inviting everybody to ask that question when we go in, because we make assumptions. We assume, and the doctor is always late. And so then it's this feeling of being behind. And so having that conversation.
And that we're an inconvenience.
Yes. Yeah. And so to kind of balance that, that's why I made all this checklist and the questions I had, a place to write down what the doctor said. And it got very nuanced, like what prescriptions, what, like all of the things. So that when we went in, I could ask the question, write it down, check it off. And it was in my brain. And then when I went to the next specialist or the next doctor, or even the next year, I'd be like, okay, this doctor said this. And I have notes from last year when we said this. And I didn't to recall it. It became this little beautiful little history book of sorts. And so that was the first dream. It did come to fruition. It is I made that. I am, like I said, looking at revisiting that. But you can do that on a piece of paper. You can have those conversations, be like, okay, what is the thing? And so you have more confidence. You're going in more articulate. So you have that clarity, and you're not waiting, guessing, hemming, hawing. And so you can also hold the other human's attention who is in the white coat. You can hold their attention because they are engaged in the conversation, because they're not just like waiting for you to
Yeah.
just
And because I think, if we don't give them information, they've got nothing to work with.
yeah. And then they're like, okay, so we're done because you got nothing.
Yeah.
So I'm going to go next door.
Exactly.
Yeah.
Exactly. And I put your website in the chat here, erincopelan.com. Go in there, find that workbook, find those questions, get that. It's a great resource to have with you for yourself, for others. Go get that. Also, Welcome to Caregiving's there. The book. I mean, and the thing about Welcome to Caregiving is, one, you never know when you're going to be a caregiver. These things tend to surprise us. And two, caregive for yourself. Caregive for yourself, because if you're not running on, with a top efficiency and knowing what's going on with your body and feeling equipped to go in there, then it's going to be difficult to come out with the results that you're looking for. So for me in this one, I really think about writing things down ahead of time. This is something I learned because for years I didn't have a lot of things going on. And so when I started having things going on, I'd get in there, I'd be ready, and then I'd forget one or two of the things. Oh, I didn't ask about that. And then you got to call them back. And they never really, sometimes you can get a nurse to talk about it, but most of the time they want to come bring you back in again for another appointment. So I started writing things down in a journal. And then our friend Kim Mosman, oops, my pen dropped. She created this wonderful manual. It's called My Owner's Manual. It's fantastic. Go to kimmosman.com. It's on the resources page. If you don't catch this stuff in the chat today, go to embracinglayers.com to our resources page for today's episode. And it's going to have the link to this. It's also going to have the link to Erin's stuff. But this thing is fantastic. It gives me a place to not only write down the day of, but like track what's been happening. Oh gosh, this has been happening for a while. And sometimes I'm able to solve the problem myself. I'm like, oh, when I eat this, this happens, and this happens, and this happens. So I think I figured that one out. This one I'm not so sure about. So I'm gonna track this. I'm gonna track when it comes up, or just even if you've got nothing going on, but you've got things you're thinking about, whether it's age related, whether it's I'm going to this country, this state, this area. I've been hearing about this. What do I need to do? Write it down ahead of time. Keep track and keep it like a timeline in your owner's manual, in your journal, wherever. So you just take this thing with you and you're like, okay, I've got the pages marked where I've got the questions. It makes it, and then you're clearly communicating. You're like, well, I think this might be going on, but I'm not really sure. I've been having these headaches. I can't really figure it out. Well, how long have you been having the headaches? If you have a headache more than one time in a week, start tracking that. What's happening here? And if you can't figure it out, then you've got, this started happening in November, and it just gives clarity, and it help your doctor help you. It is really, I think, the point on that. Okay. Common mistakes patients make during medical appointments. I feel like we've already kind of covered that. Erin, do you want to wrap that up in any way? But I think we've already kind of talked about that.
I think the only one I'll add, because I got really good at this over time, is if you're a caregiver, taking over for your patient. And I knew so many things that it was kind of like an appointment between me and the doctor about my husband. And he was
Yeah.
like, he said to me, like, Erin, you're using words and I don't even know what they are. And I'm like, but the doctor knows what I'm talking about. So you just
You just sit here and let us mind your body for you, even though you're the
right.
one living in it.
And I was trying to be efficient and I wanted all the things taken care of. And I had like all the questions and I had talked to him before. And so that was a very anxious, basically an anxious attachment style of mine to just take over
Yeah,
the situation. And so
sure.
now I'm much better. I do have my questions, but I really try to be mindful of letting the patient speak for themselves.
Mhm.
And sitting back and watching and letting them navigate their own appointment and then step in if either there's a miscommunication or I had an extra question that wasn't handled. So I try to be just more of a scribe and present and instead of
Mhm.
hijacking the appointment.
Yeah, and then you can be there to be like, "Well, what about that thing?" And maybe remind them of
Yeah.
things.
Yeah.
Yeah, yeah, that's an important one, and that's a hard one, especially when you've been managing the care. I think that
I
can
mean,
be
that took me
difficult to remember.
16 years to kind of figure that one out. So,
Well, and I think this can come up with our kids too. I found, especially with my kids, especially as they got a little older, they got old enough to speak up for themselves. They got old enough. I was still going in there and having a conversation. They were kind of sitting there taking it all in instead of, I figured it out eventually, but because one of them spoke up and it's like, can I actually speak for myself here? And I'm like, yes, you can. And so we started turning it over to her and letting her share. And then we would fill in the gaps of things that we were also and it also teaches your kids to advocate for themselves when you give them the ability as they get into especially if they get into the teenage years and they really can't tell you what they're feeling. It also teaches them to have conversations with the doctors. It teaches them to share what's going on in their bodies. It teaches them when a doctor is not maybe somebody you want to work with anymore because they're not. It's okay for you to walk away and choose somebody different. You don't have to be gaslit just because they're the expert. And so, yeah, I think that that's the biggest thing too, is for me is just remember that they're human and that we're not just, if you want to know a why behind it, keep asking questions. It's your body. You get to ask questions about it. You get to search for the things that feel healthy and safe for you. And so not just defaulting to, well, I must not be able to trust myself. I must be wrong here. Don't just default to that because they're the doctor. Be honor yourself and remember that they're human too. And going back to all the other things, excuse me, that we've already said about being prepared going in. Okay. Why honesty about pain and symptoms leads to better care?
this is such an interesting question. And I think it's the hardest thing for medical professionals because we filter things. And we,
Oh,
as patients, we decide, well, if we have little fake story conversations we make up. If I tell the doctor this, they're gonna think that. I don't want to take this pill, so I'm just not gonna mention this thing.
oh man.
We
Yeah.
do stuff like that. I
Yes,
had
we
a doctor
do.
say I had a doctor say recently that it is helpful when a family member comes because sometimes the patients don't tell them the truth.
Yeah.
And that always blows my mind because I'm like, then why are you there? But sometimes we go in with something that we want in particular. We want a particular outcome. And so we filter information or sometimes just lie. We just lie
Yeah. Yeah.
because
Yeah.
because we think we want a thing instead of having open and honest communication. So I always think it is prudent to be honest with your medical doctors, your mental health professionals, because I've had therapists say that too. Like a lot of people
Mhm.
go to therapy and just don't tell the truth. They just
Yeah.
don't tell the truth. And how is somebody going to treat you effectively if they can't even attempt to put the pieces together because they have pieces from an entirely different puzzle. Like put
Yes.
together a jigsaw puzzle, one of a castle and one of a lake, and it's not going to match up. So you're never going to get
No.
the care that you need. So
Yeah,
tell the truth.
Tell the truth. And it, like Erin said, it sounds trickier than it is. Don't let stigmas and stereotypes and stories that you've told yourself and being afraid to be judged get in the way. The information between your medical practitioner and you is confidential. Nobody else gets to know that stuff. That's why we sign the HIPAA forms. And so you can only be, and I struggled with this. I didn't want to admit anxiety is a big part of my story. And I have learned how to manage it over the last 6 years in a way that I have a different relationship with it now. When my therapist finally convinced me, we're not going to entirely get rid of anxiety in your life. That's not possible. It's here to protect you. We're going to help you change your relationship with it. And I was like, oh, all right, fine. But within that, tied to that for a while, I was, it affected my blood pressure. And I really battled taking any kind of medication to help me with it. I wanted no, if I can get a handle on this, I don't need it. And I finally got 2 years into it. And I was like, I think I need something, just a little something to help take the edge off as I'm navigating this and I finally had to allow myself to do that and just erase the sticks and just own that that's something I needed. And as much as I'm very focused on getting why something's happening and not just throwing a pill at it, sometimes you need a little extra help, and that's okay. And there's no shame in that. For the blood pressure piece, I didn't want to be on blood pressure medication because I knew it was anxiety induced. And I knew, and also my doctor's like, yeah, and for a while we're going to put you on blood pressure medication as you get to that spot. And then once you get to the spot where you feel like, and I got to the spot where then my blood pressure was crashing too low. They're like, okay, it's time to take you off of it. You don't need it anymore. And she's like, but here's the deal. I mean, I want you to track your blood pressure at home, especially like the week before you come in, because you tend to get anxious at your appointments. And so your blood pressure sometimes is elevated. But if you tracked for me for a week, what it's been doing, and you bring that in with you, then I've got, okay, this is white coat. And this is not, here's, and so, but it was stigmas and stereotypes and having such a desire to we're going to solve this with natural, healthy, because I know where this is coming from, healthy solutions. And also sometimes you need a little help along the way. Yeah. And, and my brother's like, wouldn't you rather get a little help along the way than have a stroke? And I'm like, yeah, probably a good idea. Details. I know.
Next level of receiving and being able to receive, and there is help out there, and we can choose, and it can change, and we can adapt, and we can adjust. Nothing is permanent. Nothing is permanent.
Yeah, very good point. All right, we've talked about this already, but I think we'll revisit real quick the importance of tracking symptoms over time.
Yeah, I think I am not stellar at it, but I do think it helps with that communication. Mm-hmm. It makes things very clear. Like, okay, yep, I had a headache once. Well, I also had 5 shots of tequila, so maybe that's why I had a headache. Versus I've had a headache every single day for 3 months. Those are very different situations. So there's definitely value, especially if you notice something is amiss.
Yeah. And in that tracking process, jot down your ideas. Like, I've had a headache every day for 3 months. My workplace is also really stressful right now. I've got a new coworker, got a new employee, and don't be afraid to calculate the impact that's having and that you're getting the physical ramifications for that, and jot those things down too, and have the full conversation with your doctor of okay, maybe it's time to talk to somebody else about what is tripping you up with this new coworker. Is it an old story of something that's getting triggered from the past, or is there something toxic going on here that we need to remove ourselves from? Still bring the whole conversation in, and don't just wait for a pill to solve it, but track it and bring in the information so you collectively together can make a decision. All right. We touched on this really also. A lot of these are repetitive, but I still think they're worth visiting. Why transparency helps healthcare providers make accurate diagnoses. It's back to that don't lie thing.
Don't lie.
Tell them the whole story.
Just don't lie.
Yeah. Tell them the whole story.
Even if you don't know the whole story, also don't make up stuff. Just don't lie. Just tell them what you know.
Right. Don't add something that you think is going to make it a better or more convincing story, or makes you feel less judged or whatever it is, just as is.
No
Carbon,
crying,
tell the
right?
story. Yeah, absolutely. Okay. How to build confidence when speaking with medical professionals. This one's a big one.
It is, and I think with all speaking communication, it is practice, it's your environment, it's energy. I mean, you're going to feed off of them, they're going to feed off of you. Um, Knowing when it's just not a right fit and not forcing it and just being like, this isn't the right thing,
Yeah,
and I'm going to walk out there, or maybe it's not the right thing right now, and you get home and go,
right.
okay, so I didn't like the way they said the thing to me, but actually I think they do have a point. If they said it in a different tone, maybe I would have received it better. And so sometimes we may need a minute just to process, and that's okay too. As patients, we're allowed to say,
Mm.
let me think about it. They might get prescriptions and order tests and like all of the things, because medical professionals don't know, they don't have x-ray vision. They get all of the labs and all of the things, and they're still making very educated guesses, but they're interpreting data. And so we get to step back and again choose for ourselves. We have to trust our guts. We have to pay attention to how we're feeling and make choices for ourselves on how we want to move forward. And there's such a value, I think, in second opinions, third opinions, like, and just to weed through things and get different information. And having multiple conversations leads to a greater sense of comfort in communicating, and
Mhm.
it builds more of a trust with ourselves as well.
Absolutely. Yeah, absolutely. And I think too, I like what you said about going home and kind of taking in the information, because I've also had experiences with practitioners over the years where they were just direct hitters. They weren't great bedside manner. How you doing? They didn't make you feel warm and fuzzy, but they gave you the truth. And sometimes not in a way that felt very soft on the landing, but also when you got home, like, I don't know if I love their delivery, but it's also what I need. There's a difference between that and being gaslit and dismissed. So yeah, I think we have to like take those two things into consideration. And if you can take the more direct blow and it's giving you accurate information that's going to help you, sometimes that's the way to go. If there's someone that can deliver it in a way that feels more congenial to you and gets the same results, then go with them. But also sometimes it's just a matter of like separating out. I just didn't like what they had to say, but it's true. I didn't like their delivery, but they're right, versus they didn't hear me. They don't understand me. They're gaslighting me. They're dismissing me. And so being able to differentiate between those two things. And again, being confident in yourself to deliver the information and track it, and knowing that no, they're not mind readers. They're medical professionals. They are not mind readers. Nobody is. They can only, so yes, they may have this data, but you may have something to add that will give more information that helps. Oh, there's so many times something will come back on my blood work, and it may be like, oh, I wonder why this did this. And I'll be like, well, does it have to, da, da, da? And she's like, that's it. That's the thing. Okay, let's try this. So yeah, it's a great, so those things, don't be afraid to advocate and add in, oh, I think is this a possibility? And if it's not, then just say no. Sometimes I think we're worried about looking stupid in front of our doctors. I'll trade in looking stupid any day for not getting my questions asked and leaving knowing that I covered the bases.
For a good night of sleep, I bet you would risk looking stupid if you could get a good night's sleep.
Freaking-lutely. Haven't slept well in 4 years, but by golly, we're trying. Yeah. Oh my God. The things I would do for a good night's sleep right now. Anyway. All right. Practical tips for improving doctor-patient communication. I think we already covered that. I mean, I think it's, is there anything you want to add to that?
Nope. Just breathe. Try to go in calm. Write down your questions and tell the truth.
Yeah. And stop and pause. Like at the end of the appointment, pause for a minute. Don't feel the pressure like, oh, they got to get to the next patient. They were already 15 minutes. Like for me, pause for a minute and give yourself time to consider whether you forgot something, even if you've written it all down. Go back through your notes carefully to make sure you didn't skip over something. Maybe they brought something up, so you skipped a few things on the list and thought you'd come back to it later, but then you didn't. So it's like, let me look through my notes one more time. Let me make sure I covered everything. I'd rather do that than have to, add more to both of our time together by having to come back here. They appreciate that too. They appreciate that too. So I think that would be the big thing. And then again, don't be afraid to walk out of situations where you're being dismissed. Nobody has to be rude about it. You don't have to be the bad guy. You just simply don't go back there. You simply find somebody else who you think you might connect with. All right. To wrap this up, why trusting your instincts about your body matters?
Oof. I mean, we just know ourselves best. Especially when we can find those moments of quiet. It's really hard, especially when you're facing a scary medical diagnosis or you're in pain and you just want an answer. It can be really difficult to find that quiet and that inner knowing, but we all have it. Mm-hmm. And we know, and we know when we also know when something is not right. Like we will get the hell yes or the hell no. Like it is there if we listen to it. And that also takes a little practice, because sometimes just being anxious about the yes might be there, but it's also scary. I know this is the thing I have to do, but that scares me. And, but we're the ones that know best. We really are.
Yeah. Yeah. And don't minimize symptoms. I mean, I think, oh, that's not a big deal. How many times as women do we say, oh, that's not a big deal? Don't let it become a big deal. Trust yourself. If you're feeling something, communicate it. And again, I go back to no one lives in your body besides you. So no one knows your body more than you. This took, for me, I lived disassociated from myself for a lot of years. So this took me getting real with myself, getting present with myself, learning to connect with the emotions and feelings I was having that were maybe masking some of these things. So it might just require a deeper dive to really get in touch with your body, but you live in it. The doctor doesn't live in it. They can't read your mind. So you can help you and them by trusting your instincts and sharing all the information. If it's nothing, it's nothing. Great. One less thing, check that off the list, move on. But if it's something, get on it early and figure it out, and don't let it become a bigger thing. So trusting yourself. Nothing's too big, nothing's too small. Yeah, I think that's a big thing. Okay. So some key takeaways we hope you got from this today. No one knows your body better than you. Clear communication leads to better health care outcomes. Speak honestly about symptoms, pain, and concerns. Don't minimize or dismiss what you're experiencing. Write questions down before every appointment. Your health deserves to be your highest priority, even as and while you're taking care of others. And that's where Erin's resources really come into play. We don't put our health on the back burner just because we're caring for somebody else, because we're not going to serve them or ourselves very well if we put ourselves on the back burner and all of a sudden we need someone to take care of us, or we're not available to take care of them anymore. There's so many things. So don't let it become a lesser priority. It deserves, and you deserve for it to be your highest priority. Self-advocacy isn't being difficult, but it's being informed and proactive. I learned this from my mother-in-law. She was some doctors in her generation's worst nightmare, because she wouldn't just take their answers carte blanche. She was curious. She was insistent. She was highly intelligent. She did her research, and she wasn't afraid to speak up on behalf of herself or her kids. She was truly a woman before her time. But I learned the importance of that from her, because the second time she had breast cancer, she had passed the 15-year mark. She was supposed to be clear. Sure enough, the next year it came back. The doctors wanted her to wait 6 months. They didn't really think it was a big deal. She bypassed them, went straight back to Virginia Mason in Seattle, who treated her the first time and said, I think there's something going on here. Sure enough, there was. And because she was willing to not just take their word, and she wasn't willing to wait, this didn't become a bigger problem. She had another surgery. She opted to do a mastectomy this time because she was didn't want to deal with it anymore. She made that decision for herself, but she trusted herself. And that stayed with me. And I'm like, damn, they missed it. They missed that was a tumor because they wanted to wait 6 months. And sometimes there's a time for that and sometimes they're not. And she trusted, nope, I know what this is. I've had this before. So self-advocacy, no matter if they make you feel like you're being difficult, then they're not the right place for you. You get to advocate for yourself. You get to demand the best healthcare for yourself. You get to demand you be listened to and that your practitioners respect that you know your body better than anyone else.
And just to build on that as my kind of closing thought, in the 4 agreements, Don Miguel Ruiz, he says, don't take anything personally. So if you want the test and get the thing and they're like, okay, fine, we'll give you a little test. Go ahead. Don't take the response personally. You know what you need. You're getting the thing that you need, and you get to move forward. It's not personal. Don't take anything personally.
Yeah, absolutely. 100%. Thank you so much, Erin, for joining me today. I knew it was so important to have you part of this conversation. I'm like, this is more than a one-on-one conversation. I've got people in my circle that have lived this in a level even above what I have lived it at and can bring in a different perspective and has actual resources to help people out there with this stuff. So check out Erin's resources. And don't be afraid to reach out. She works with people one-on-one as well. If you need more help and support in this area, reach out to her. If you just need work on trusting yourself and trusting you know who you are and needing support and speaking up for yourself in general, reach out to me. Let's have some empowerment session conversations. Let's talk about you trusting your instincts, embracing your layers, knowing your value, knowing you deserve to be heard. Go to embracinglayers.com and fill out that contact form. We've got resources. We want to help you. We want you to feel empowered. We want you to feel equipped, and we want you to trust yourself. So thanks for joining us today for this conversation. We appreciate you, and I'll see you next Tuesday right back here live on Substack, or you get it later on your favorite podcast platforms, whatever you prefer. We've got both available for you. Take good care of yourselves, and we'll see you next time here on the Field Podcast.